Hey friends, my name is Ernesto Calumpang, and I recently just graduated from West Coast University and passed my NCLEX with 85 questions, which means I am now officially a registered nurse. Today, I want to share with you a roadmap to successfully pass your exit exam and NCLEX on your first attempt. We're going to go over 4 different sections. We have Section 1, the Blue Book, Section 2, ATI, VATI, and the Greenlight Program. We're going to go over Section 3, creating a schedule just for you, and Section 4, studying smarter and not harder. Starting with Section 1, the Blue Book. Now, this book has a lot of information, and I'm not going to lie, I was not able to read everything because there's just so much. So don't overwhelm yourself by trying to read every single word and trying to memorize everything. You'll realize while you study and do questions anyway, a lot of the information is coming from the book, so you're studying as you're doing questions. So don't try to cram everything, okay? Take it slow, read what you can, and underline and highlight what you don't know. If there are 3 absolute things that you should do, and if you don't read the book at all, you have to do these 3 things. These are the 3 things I recommend. Number 1, highlight these points to remember. Every time you see point to remember, highlight and make sure you read that, because these are one of the key concepts that the NCLEX and VATI and the exit exam, everything will go around these points to remember. For example, right here, you can see the point to remember for this is auscultation is not a reliable method to check for NG2 placement. You want to use X-ray, as you can see, and it shows you exactly what the gastric pH should be for secondary placement checking. Perfect. That's exactly what we've been tested on. Point to remember: if a residual exceeds 100 mLs for feedings or 2 hours worth of continuous feedings, hold or stop the feeding. Do not refeed. Aspirate. Exactly the types of questions we get. So these points to remember just show you what is the most important things that you need to know to pass the exams. Now, the second most absolute thing that you have to look at in this book are charts. Charts are going to be your best friend. As you can tell here, a chart would be like these: motor skill, development of the infant. This is pretty digestible, right? I mean, a lot of this information you should know in general, but charts help it to break it down easier. It kind of summarizes everything that you're supposed to know. So read these charts. Any charts that you come across in the book, if you were to look at anything, these charts are mandatory for you to know. And the third most absolute thing that you can't skip out on are the activities. These activities are located within each chapter, but they're also located in the back of the book. So make sure you do these activities with a classmate, or you'll do some during class as well, but make sure you study the rationales, remember, because they kind of point you in the right direction of what the exit exam and the NCLEX is asking you. So make sure you do these activities and make sure you're checking your answer as well. Now let's move on to Section 2, ATI, VATI, and the Greenlight. So before we do anything, I want to make sure you have a way to organize your notes that is accessible and easy for you, okay? So if it's a Word doc, if it's pen and paper, I mean, who does that, right? Anymore. But I use Google Docs, and this really helps me to organize everything. So I pretty much just label it. So let's say I'm maternal, right? 493, farm 493, everything all in one. So that way, if I need to pull anything from farm, I can just click on this. If I need to pull anything for peds, I just pull on this. And essentially, this just helps you to kind of organize everything in one doc. You put your ATI questions on there, notes from your book, keep it organized, keep it labeled, and that essentially will help you to kind of go back and you're not scrambling with all your notes, okay? So this is an example of how mine looks, and you could kind of make yours your own. Now, in terms of the types of questions that you are going to want to do, you're just going to want to make sure you follow your professor's guidelines of exactly the types of questions you're going to do each week. But in general, they're going to be assigning you the comprehensive practice questions, which are going to have the next generation questions. So make sure you do those and study all the rationales. These standard quizzes are also perfect as well, because they kind of just summarize exactly everything you need to know per one topic. They're about 40 to 50 questions. Some of them are 30. And then now you have your dynamic questions. So these are just CAT exams, and make sure you press the NCLEX board exam, adaptive CAT. So this just changes the questions every time you answer, depending on how you answer them. This will mimic exactly how the NCLEX feels, so make sure you do these. If you're feeling great one day, do the board vital questions. If you're not feeling so great, do the learning system. So it kind of gives you a good balance of the two, and you'll diversify your studying that way, and it will help you. Every time you get a question wrong, make sure you put that on your notes, the rationale. If you got it right, make sure you also note the reason why you got it right if you guessed correctly, okay? Now VATI. VATI stands for Virtual ATI. You only technically need to complete the first 3. However, I argue you should complete all of it to first get the green light, but second, it really helps you study for the exit exam and the NCLEX as well. Learning activities down here, so you just go to any of your topics and you click on learning activities. Click on any of these. I can't right now since I ran out of my subscription, but you click on these and it essentially is the pink book or the blue book in a way that's really easy to understand. So if you forgot what pressure ulcers, the different stages, click on this. If you need to understand what chemotherapy agents was, again, click on that. Pain medications, bone meds. So anything that you really need to learn about, again, this learning activities will help break it down for you in such an easy way, okay? So I definitely would recommend studying that. Now, once you've done the learning activities, you want to make sure you also read a little bit of the book. And then once you're ready, you take your pre-assessment quiz. This helps you kind of just gauge on what the assessment actually will look like and the types of questions you can get. Take notes on the rationales of what you got wrong, what you got right. Rationales are your best friend in studying for any exam. And then after that, you take your assessment. Once your assessment is complete, depending on how well or not so well that you've done, you'll generate a focus review on just the things that you need to work on and things that you got incorrect. So make sure you take notes on a separate Google Doc. Just use the Google Docs that I've been talking about. If you have Form 493, put all your notes on there. And so that way you can go back to it later on, because you can't I can't pull up my focus review anymore, what I submitted. After that, usually a post-study quiz will generate if you're scored a little bit lower. Sometimes they don't generate. So make sure you complete that and also perform all the rationales that you need for that. And last but not least, you're going to generate a post-assessment assignment, which is essentially your remediation that you want to submit. Your coach will grade that, and that will complete your entire module that you have to complete for this. Mine was farm, and then you continue on to the next one. Now, something I want to share is use your time wisely. Your time is very valuable here. Okay, so what I mean is a lot of us are okay with funds. Farm, we don't feel really good on. Med-surg, 50-50, right? Maternal newborn, nursing care of children, these two are difficult. Especially farm. These 3 are the biggest topics that I notice a lot of us need work on. So spend the full week on these. Now, mental health, leadership, you could kind of do both in 1 week pretty much. So what you can do is use your time wisely and make sure you put all the effort into the topics you need to learn, and then a little bit lighter on the topics you don't. So that way you're not burning yourself out by trying to give a full 100% all of these. Study what you need to study. Don't try to learn everything all at once, or else you're going to get burnt out. And as soon as you finish all of these, you're going to unlock the NCLEX readiness. This only unlocks after you exit exam, and then you're going to complete this comprehensive online practice assessment. And essentially, this just is a 180 question exam, pretty much like your exit exam. And this is a pre-assessment before you even sit down for that predictor assessment. You have to get over a 72 in order for you to, pass this predictor assessment. One thing that I want to share with you now, as soon as you get 72 or greater, it will reveal right here. It will show your result right here. You will immediately send that screenshot, including your Pearson login information, to Steven and email that to him. And then he will make sure that he pays for the ATT fee, and that's how you get your 750. Okay. Now let's move on to section 3, creating a schedule just for you. Now everyone's going to have a different schedule, but let me show you what my schedule looked like so you can kind of get an understanding of what yours could look like as well, if you don't have one yet. For example, our theory day was Friday, and usually this is when the VATI remediation templates are due on Canvas. So on Sunday, I would do the learning activities, like I mentioned earlier. I would do my pre-assessment and then perform my assessment as well. Of course, performing notes as I go along. On Monday, I would do my focus review, my post-study quiz, and my ATI questions. If I have time, I'll start my remediation as well. By Tuesday, Wednesday, I want to make sure I get that post-assessment assignment done. I'll do my VATI review, and then I also do my ATI questions, so things that are assigned to me in my theory course. On Thursday, I would do my blue book content-wise, because I need to actually start studying content, ATI, and I'll do a CAT exam, the one that can go all the way up to 150. On Friday, I have my theory, and in theory, I review all my notes. The professors are going to go over that. As soon as you go home, review all the notes. Essentially, go back to that big Google Doc that you made, highlight, underline, just reread it again. Repetition is the success to your exams, okay? Submit all your assignments, because it is Friday. Remember, I said everything's due. So you want to submit everything like your VATI. And if you're done with the questions, those are due Sunday, but just submit it on Friday, bam. You got the weekend off. You have clinical the next day, example, and then now you can start your new module, start it a little bit early. And there you go. That's essentially how I studied and how I kept everything on track, so I wasn't falling behind. Now that's my schedule. Your schedule could look a little different depending on when you have clinical, or if you could complete things faster, a little bit slower, but this just gives you a nice baseline of how I completed things in a timely manner. Now let's move on to section 4, which is studying smarter and not harder. Now, what exactly do I mean by this? There are different tips that you can use to kind of make things a little easier for you to study. So the first thing is finding patterns, okay? So this is the pediatric vital signs, and this is not easy for anybody, including myself, to memorize at first. But let me show you this one trick, and this shows you exactly how to find different patterns to study. All you really need to know is the age groups, and we know this: infant, toddler, preschooler, school age, adolescent, right? We know all this, okay? So all you need to know is just finding the right pattern. As you can tell, the blood pressure, it pretty much goes up as the age, goes up. So you have, it starts off in the 6s. So blood pressure starts off in the 60s. It goes up to the 70s, goes up to the 80s, goes up to the 90s, the 100s, which is the 10s, and then the 11s, which is the 110. And what's pretty cool about it is the heart rate is the inverse. It starts off at 11/110, and it goes down 100, goes down 90, goes down 80, goes down 70, goes down 55, 60. It's like a seesaw. Everything's inverse here, right? The respiratory rate is pretty easy: 3, 3, 2, 2, 1, 1. Fill in the blanks: 30, 30, 24, 20, 18, 12. There's a pattern to this. And the more that you study, the more you can recognize different patterns that exist, and bam, that will help you study so much easier because you're making it less stressful for yourself. And on that note, use different mnemonics to help you memorize. For example, you want to make sure you suction with a bulb suction the infant's mouth first and then the nose, right? How exactly should you remember this though? Use the alphabet: A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, right? Mouth, then nose. So little things like that. You will find different patterns. You'll find different mnemonics. If you find a mnemonic online, share it with your friends. It'll help everybody. Now, the third thing is to relate on what you know. Now, we can't learn everything. Let's be honest, we're human beings, right? So we know bits and pieces. The thing that I want to share is that you can relate things to what you already know. Let me show you exactly how cool this is, okay? For hypomagnesemia, there's a lot of different things here. You got trisocine, Travoc, hyperreflexia, right? Seizure precautions. What do you want to give? IV mag. Hold on a second. This kind of sounds like a preeclampsia patient, right? Hypertension is right here, right? That's preeclampsia. Hyperreflexia, the DTRs, right? So Trousseau's, Travoc, and seizure precautions, right, with preeclampsia. So just relate hypomagnesemia with preeclampsia. Now you don't have to memorize hypomagnesemia because now you know what a preeclamptic patient looks like. So that's a really cool way of just connecting things that you already know. Look, hypermagnesemia, the exact opposite. Think of mag sulfate toxicity. If a patient is on magnesium and it's toxic, we got hypotension, bradycardia, bradypnea, hyporeflexia, monitor DTRs. See, everything kind of relates to each other if you just find a way to kind of bring it back. What do we know? Take a deep breath. You know this, okay? But this shows you how to relate on what you know when studying content. Now, how do you relate on what you know when answering questions? Well, let me show you exactly how to do that. There are different levels of difficulty of questions, but you can answer anything once you start to relate on what you know. So level 1, level 2, level 3, and level 4 questions. Level 1 is being the easiest, level 4 is being the most difficult. So let's go over this level 4 question. Let me show you exactly what I mean. The nurse is providing patient teaching on spironolactone. The client requires further teaching when stating, I will exercise daily before eating. I will take my blood pressure after I take the medication. I will contact my provider if I become dizzy. I will take my prescribed stool softener as needed. As you can tell, it's kind of weird. Like, what do you choose, right? Because this is a level 4 question. Let me work all the way up from level 1, 2, 3, and then I guarantee you will be able to answer level 4 like that, okay? So level 1 question. The nurse is educating a client on a side effect of spironolactone. The nurse shows understanding when stating hypertension, agitation, joint pain, or polyuria. We know that spironolactone is a diuretic, and diuretics increase what? Urination, which means the answer is pretty simple. I guarantee most of you got this right, and the answer is polyuria. Not too bad, right? How about this? The nurse is providing patient teaching on spironolactone. The client requires further teaching when stating, I will eat a low-fat diet. I will eat potassium-rich foods. I will sit to stand slowly. I should not take more than the prescribed amount if I miss a dose. Further teaching. What is incorrect? So spironolactone is a what? Potassium-sparing diuretic, meaning that the potassium in the body is kept and is retained, meaning that it can go up, hyperkalemia. So the correct answer would be, I will eat potassium-rich foods, because now if they're hyperkalemic, you eat more potassium, you're going to increase that potassium even more, So that's a level 2 question. You can tell Here is just asking you a side effect, right? Polyuria. Here, you're thinking about a side effect, which is hyperkalemia. So what do you want to make sure they don't do? Eat potassium-rich foods. You're now doing a two-step process, level 2 question. Now, level 3 question. The nurse is reviewing spironolactone and its effects on acid-base imbalances. Oh, how does that relate, right? The nurse is correct when spironolactone can cause which of the following acid-base imbalances? So we have respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. Now you look at that and you're like, hold on, spironolactone, diuretic, how does that relate with, like, that's electrolyte, and then now you're talking about acid base? It doesn't make sense. Like, that's a level 3 question. Now you have to start thinking critically, right? Let me break it down for you in a way that's so easy to understand, okay? Spironolactone, as we said, can cause what? Hyperkalemia, because it's a potassium-sparing diuretic. Correct, right? Now, hyperkalemia can cause what? Diarrhea, right? We can cause GI upset, diarrhea. Diarrhea can cause which acid-base imbalance? Pretty easy. Metabolic acidosis. We've learned this because you are now getting rid of all the base in the GI tract, and you're now keeping all the acidity in your body. So the answer is metabolic acidosis. Do you see how we had 3 steps to do in that question? We had to think about 3 different factors. They all went in line to each other, and that's a level 3 question. Now, I know that was difficult. Let's try the level 4 question. If you just keep following this pattern where you think about things critically, it will help you understand. A level 4 question. The nurse is providing patient teaching on spironolactone. The client requires further teaching when stating, I will exercise daily before eating. I will take my blood pressure after I take the medication. I will contact my provider if I become dizzy. I will take my prescribed stool softener as needed. We can answer this now after doing levels 1, 2, and 3 because we understand the thought process behind it. Spironolactone, potassium-sparing diuretic, can cause hyperkalemia. Hyperkalemia can cause diarrhea. Diarrhea can cause metabolic acidosis, which we don't want to cause, right? So when the patient requires further teaching, we want to make sure we choose an answer that prevents them from having more diarrhea, right? I will exercise daily before eating. Exercise is good, for just everything, right? Why would we want to take blood pressure after I take the medication? It sounds like you would require further teaching, right? Because you want to make sure that they take their blood pressure before the medication. But this is not wrong as well. You could take your blood pressure after taking the medication. It's not saying it's completely wrong, right? What's the most orange? Remember, that's how you want to think about the NCLEX and the exit. You choose the most incorrect or the most correct, depending on what the question's asking, right? I will contact my provider if I become dizzy. You want to do that, right? I will take my prescribed stool softener as needed. They're already having diarrhea, right? Because of the hyperkalemia. So that one, why would you want to have them take a stool softener as needed when they're already having diarrhea? We don't want to cause further metabolic acidosis. So that's a level 4 question. And now, if you just go back up here, we know the answer. So that's how I want you to relate on what you know when you're answering these types of questions. When you're studying, relate on what you know. When you're answering questions, relate on what you know. You were given everything in nursing school that you need to know. Just relate it back. You got it. Now, next thing. I know many of you love to use outside resources. Heck, I did too. Okay? But use that to supplement ATI. Okay? YouTube, Simple Nursing, Level Up RN. Use these. Okay? I'm not telling you not to. These are great things. Sometimes I'll listen to some Level Up RN while I go on a walk. Another tool that a lot of people are recommending is Archer. Sure, go ahead and buy Archer if you want. I would definitely recommend the Greenlight a lot more, but if you want to supplement something, use that. But use the Greenlight as the main source of your studying and use these other things to help kind of reaffirm to you that, hey, you still got it. And if you do use Archer, make sure you use the NCLEX readiness assessments, and this will just make sure you get 4 in a row of high or very high, and bam, 99% pass rate. And that, including your Greenlight, that 99% pass rate, you're good to go, okay? That's just if you want to. You don't even need to buy it, but I know many of you will, so let me just give you that advice now. Now, whatever you do not use Quizlet, okay? Especially this late in the game, don't use it. This will hurt you more than help you. For those assessments for VATI, Quizlet is not your best friend because you're not studying correctly now. You're just trying to find a way to get by faster, and it's not going to prepare you for the exit because there's no Quizlet for the exit. There's no Quizlet for the NCLEX. There's no Quizlet when you're doing direct patient care and you need to know what VATI and ATI taught you. So don't use Quizlet. That will hurt you if you do that. And last but not least, for the 3-day live review, I know which is coming up pretty soon, rent a room. I don't live close to campus at all. I live like an hour and a half away with traffic. So rent a room close to campus for a live review, the 3-day live review, if you live pretty far away. I rented an Airbnb with 3 of my closest friends for 3 days, and I paid like $200 because the Airbnb was around $800. It was worth it. When you know you're completing the Greenlight and are going to get $1,000 for it, it's worth it. You have to make sacrifices in order for your future to succeed, okay? And last but not least, reach out if you need any help. Steven, Amy, your professor, your ATI coach, even me, heck, if you want to reach out to me, go ahead. We're all here to help you pass your exit exam and ultimately the NCLEX and help you become the best nurse that you can be. Remember, with anything that you do, put 200%, because even if you fail, you're still way above 100%, right? Believe in yourself, because guess what? I believe in you. Always remember your why. Use that to carry yourself to the finish line. And eventually, carry and build your nursing practice upon that. Your patient and your community will thank you for it. Thank you so much for watching. Please keep going. You got this.